Good afternoon, everybody. The Secretary to the Government of the Federation, honorable ministers here present, of the press. Nigeria now has 3,145 persons confirmed to have COVID-19 in 13 states and the Federal Capital Territory. The 195 persons who tested positive yesterday were reported from 13 states distributed as follows: 82 from Lagos, 30 in Kano, 19 in Zamfara, 18 in Sokoto, 10 in Borno, 9 in the FCT, 8 in Oyo, 5 each in Gombe and Kebbi, 4 in Ogun, 3 in Katsina, 1 each in Adamawa and Kaduna. Sadly, 103 COVID-19 related fatalities have been recorded. But happily, 534 persons have recovered and have been discharged to go home. 21 laboratories nationwide are now operational for COVID-19 testing as we work to drive up demand. Laboratories in Kano were directed to work in shift to reduce the turnaround time for testing and enable faster return of results. The Ministry of Health task team to Kano is collaborating intimately with the state government and is fully engaged in remediation activities which strongly emphasize training and capacity building for all personnel in order to help rebuild the manpower in the state and also in federal health facilities there. These include also non-medical personnel like the cleaners, porters, security guards, especially those in the COVID-19 isolation and treatment centers. The intensive training is essential to minimize the risk of infection of personnel in the line of duty, which is becoming a major challenge in various parts of Nigeria. We do not have the latitude of having so many health workers in treatment or in isolation and being out of service in these critical times. The Nigeria Center for Disease Control routinely replenishes stocks of personal protective equipment to state emergency operation centers and the federal tertiary health institutions to ensure that our health workers are protected. But I also take the opportunity to again appeal to all healthcare professionals and associated personnel to diligently follow safety, infection prevention and control protocols, both inside and outside health facilities, and not to indulge in unauthorized treatment of COVID-19 cases. The Federal Ministry of Health has just finished a meeting with the Ministry of Science and Technology, at which the agencies of that ministry demonstrated impressive, innovative capabilities to participate in finding solutions to the problem of shortages, both in commodities and even in equipment. We are convinced that Nigeria has the potential to manufacture many of the needs which we presently import and which presently are in high global demand and are difficult to come by. I join the Secretary to the Government of the Federation in welcoming Nigerians who successfully returned yesterday to Lagos from Dubai. They have entered into a mandatory supervised 14-day quarantine in 2 designated hotels in line with laid down protocols. They will be tested, as has already been said, and any person tested positive shall be transferred to a treatment center. I want to appeal to to all our returning citizens to bear with us and to cooperate with authorities and to be patient, especially if they perceive imperfections in arrangements, as this is a test run, the first in these exercises. I shall also here request all states to embark on preparation of at least 300 bed spaces for COVID-19 isolation and treatment. As testing is scaled up and more persons with COVID-19 infection are identified, it is extremely necessary that they are safely and securely isolated with dignity and treated until they are negative in order to break the chain of transmission. Our ministerial team left en route to Lokoja today to work with Kogi State government, and it includes officials of NCDC and the Department of Hospital Services of the Federal Ministry of Health. They will ensure that the state has adequate testing capacity and also advocate for the engagement of traditional rulers and community leaders in surveillance efforts in the state. I appreciate the collaboration promised by His Excellency, the Governor of Kogi State. A similar team will also travel to Cross River State for the same purpose. Through the entry of the National Primary Healthcare Development Agency, the infrastructure for demand creation at grassroots level is being adapted for the COVID-19 response and will be invaluable for engagement of communities and population mobilization. The training of health workers will be fast-tracked in the new high-burden states, just as it was done in Kano and Lagos states, and will be replicated in all other Ministry of Health facilities. The Federal Ministry of Health has engaged state commissioners of health, especially in the high-burden areas, to find out their needs and support them in training and capacity building. I want to repeat the need for all of us to adhere to public health advisories. And as I always say, to wear your face mask, observe physical distancing, practice hand washing or hand sanitizing, and also practice standard respiratory hygiene. Avoid crowded places and especially non-essential travel, as well as report when you feel unwell or you notice someone has symptoms that remind you of COVID-19. I want to also appeal for considerate and responsible social adjustment of all citizens to the challenges we face today. These are difficult times, but we must all work together. It is not a challenge for government alone. Thank you for your attention.